Imagine this scenario. A tertiary city hospital in Kampala, the capital of Uganda, with 1,500 beds. A hospital with over 3,000 patients and an annual admission of 180,000. In the backdrop of severe scarcity. 1/3 of these patients die during their hospitalization, and 30% die within 2 months after returning home. These deaths amount to 100,000 people per year, the equivalent of a New England town that is erased from the surface of the earth every year. In spite of such horrific odds, we send our doctors, residents, our medical and nursing students to these resource-limited sites. We recognize that as they struggle to understand what they witness, they will define and redefine the definition of right and fair. They may remain motionless and mute in the face of their own helplessness as they tackle scarcity of resources, the ease and omnipresence of death. We send them because once the earth has shifted beneath their feet, helplessness will be replaced with empowerment. They return to their own lives with new perspective, one that honors each individual they have met. They will bring an invigorated sense of service to their hours, emboldened to distill meaning from their relationships and commitments. They are kinder to their own patients, pay closer attention to their patients' stories. They act less as consumers of material goods and more as consumers of knowledge and agents of change. They do this work to bear witness to social inequities, to the unshared burden of suffering, to the disproportionate scale of disease. They learn that resilience can survive poverty, and that gratitude can exist even in the last days before death, if in the company of loved ones. And they return with humility, standing beside a Ugandan intern, providing care to over 100 patients with calm and competence. Working alongside a young faculty member who dedicates Sundays to patients, quote, because who can turn them away? Even those of us who are seasoned clinicians often find ourselves without function in this environment. Not only is pathology vast and varied, but how to withhold the principles of primum non nocere. In a hospital with a dearth of diagnostic tools, nurses, and physicians, in a sea of need, they return humbled by the ingenuity with which their Ugandan colleagues make a little go a long way. The way in which they quietly shoulder the responsibility of deciding to whom to allocate scarce antibiotics or ICU beds. These are colleagues who have the option to work in the States, in Europe, but who choose to serve this community. These are colleagues and friends who look upon us with patience as we fumble with cultural competence. When we make errors in judgment, trying to save a life, but in fact bankrupting an entire family. Lastly, our residents and students return to the United States with the image of patience despite their crippling disease, surrounded by the color and vibrance of their friends and families as they prepare meals and hang clothes to dry in the sun-filled courtyard. They do this work while recognizing that medicine can encompass presence and human touch at a time when all else has failed. Suddenly, a place that was once, quote, resource limited reveals itself to be resource rich in ways we are only beginning to learn. Many of them will return to Uganda, to similar places, time and again, because it is easy to be happy when life feels so full.